In this video, I'm going to discuss how we initiate a TPA infusion or alteplase infusion for a patient diagnosed with acute pulmonary embolism. Now, this procedure is going to be different than what we're used to for stroke patients. So unlike stroke patients, the pharmacist will not provide two syringes with the TPA. Instead, they will reconstitute the medication or the TPA in the vial itself and provide the actual vial to the nurse. So this is the actual alteplase or TPA that contains 100 milligrams in 100 mils. So it is a 1-to-1 infusion. It is a dual verify. So anytime we're giving TPA, we should have a second nurse verify. But in this condition, pulmonary embolism, alteplase or TPA, 100 milligrams and 100 mils is going to be given over 2 hours. So it's a 2-hour infusion, and that will come out to 50 mils per hour on the pump. So again, this is how the pharmacy is going to provide the TPA to you. Now, this glass vial is very similar to ones that you would see, let's say propofol or nitro, where they have this little tag here, or this little loop that you can pull down and actually hang it from the IV pull itself. So very similar to those preparations. When we go to spike this, we definitely want to do it in a certain fashion. So we take the drip chamber here itself. Remember, we've got this little cap here, this vent cap. We want to keep it closed into the appropriate time. So we're going to depress the chamber here, and then we're going to go straight into our medication vial here. Notice I've got the medication vial on a very firm surface. I go straight in 90 degrees. Once I get it spiked, while I'm still pressing the chamber here, I'm going to right it up. Okay, and I'm going to let this chamber fill to about 2/3. Notice I do not have the vent cap open yet, so let it fill up to about 2/3. Once it fills up to about 2/3, then I can go ahead and pop the vent and allow air to enter. We don't want to pop that vent too prematurely because then it may get moistened and not be able to pull air in, and then you'll get all kinds of alarms on your pump. So again, the pharmacist is going to provide this vial to you, 100 milligrams in 100 mils. It's going to be given over 2 hours. It is a dual verify, and then we discuss how we properly spiked it. So then we're going to come over here to our pump, and we're going to hit channel select. We're going to hit guardrail drugs. We're going to scroll down to alteplase. So scroll down to alteplase, and we can see it right there on the menu. So alteplase. In this example, we're going to be giving it for pulmonary embolism. So we're going to select pulmonary embolism, and it's asking us, is this 1 milligram in 1 mil? And the answer to this is yes, because recall that the alteplase is 100 milligrams in 100 mils. So the answer to that question is yes. So we're going to select yes because it is a 1-to-1 preparation, 100 milligrams in 100 mils, which is 1 milligram per mil. So yes. And then we're going to come down here and we're going to select next because there is no patient wait. It's the same for all pulmonary embolisms in the adult population. So on this window, you can see that the rate is already pre-programmed in at 50 mils an hour. That's going to deliver a dose of 50 milligrams an hour, and that's going to result in this infusion going over 2 hours to get the full 100 in. So the VTBI, the volume to be infused, is going to be 100 mils. And recall, that is the total volume that is in the alteplase or TPA vial, 100 milligrams and 100 mils. We're giving 50 milligrams per hour, okay, which is 50 mils per hour for a total volume of 100 mils in that vial, okay? So we're going to come over here to start, and we look over here to scrolling marquee, and you can see it says alteplase 50 milligrams per hour or 50 mil per hour infusion rate. This will be delivered over a 2-hour time frame, okay? So just to recap, this is TPA or alteplase, 100 milligrams and 100 mils. That is going to be delivered over a 2-hour time frame for a patient diagnosed with acute pulmonary embolism. It is a dual verify medication. It does require a consent from the patient. You should have at least 2 IVs already inserted into the patient, and to consider the need for a Foley. That should also be inserted prior to TPA. So other than that, you'll want to watch your patient for at least the first 30 minutes to see how they react to the TPA and make sure they don't have any untoward effects. And hopefully you'll find that to be helpful.